Hello, today I'm going to be talking about postpartum complications. Um, alright, so I'm first going to talk about what postpartum is. It's a period just after delivery, and it's also considered the fourth trimester of pregnancy. Alright, so I'm going to talk about the uterus and like how it's supposed to move after delivery. So subinvolution, that's when the uterus does not return to its normal size, and that's bad. And then involution is when the uterus returns to its normal size, and that's how it should just go down gradually after giving birth. So the postpartum risks: hypovolemic shock due to hemorrhage. As you know, like when you're pregnant, your body's volume goes up. There's infection, trauma during delivery. They all are considered risk factors to cause postpartum like postpartum issues. And fatigue is also one of the indicators that like something can be not normal after you give birth. Like, yeah, you're gonna be tired, but like you shouldn't be having fatigue that much. And then risks continued: preeclampsia, that's when you have hypertension during pregnancy, and then diabetes, cardiac disease, overdistension of uterus, abruptio placentae, and placenta previa, precipitous labor, prolonged labor, uterine atony, retained placenta. Those are all risks. So I'm first going to be talking about postpartum hemorrhage. This is when you lose more blood than you should. And if it's a vaginal birth, it's more than 500 ml. Cesarean, more than a liter of blood. There's two types of hemorrhage: early and late. Early is within the first 24 hours. So like if you bleed more than those certain amounts of blood within the 24 hours, and then the late is when you bleed after the first 24 hours and up to 6 weeks postpartum. Early postpartum hemorrhage causes uterine atony, boggy fundus. When the fundus is boggy, you need to massage it. That's the first intervention. And if that doesn't work, you're supposed to ask the mom if she can like get up and void, and if she can't, you can catheter. Put a catheter up and see if that helps. And other causes can be lacerations, which can either be an episiotomy or a tear during birth. I'm going to talk about uterine atony. This is one of the more common problems that women have for early postpartum hemorrhage causes. So if the uterus is boggy, you massage it, and if it's still boggy, you empty the bladder. And early recognition is important. The pharmacological treatment is oxytocin, IV or IM, methylernonavine, Malatay, or methergine, IM or PO, and then carboprostromethamine, IM, and then misoprostol, rectally. These are given after birth if the uterus is boggy to firm it up. Lacerations. So there's 4 degrees of lacerations. First one being not too deep, and the fourth one being like the deepest cut. So the first one is skin and vaginal mucosa. Second degree, perineal muscle, but not the anal sphincter. Third degree, anal sphincter. Fourth degree, rectal or anal mucosa may cause incontinence. And the most important thing is like you don't want to cause any more issues, or you don't want to cause infection when the mom has a third or fourth degree laceration. So no rectal temperatures or suppositories. Late hemorrhage causes. So this is blood loss of more than 500 mLs after the first 24 hours to 6 weeks. Manifestations include increase in bleeding, which is going to be rubra color, like red. Uterus not well contracted, clots, and that's most likely like retained placental fragments. That's when you have to manually go in and take out the placenta. I think the provider does that, I'm not sure. And then the lab results are going to show low hemoglobin and hematocrit. Signs to look out for during postpartum: heavy bleeding, foul smelling discharge, elevated temperature, persistent cramping and abdominal pain, calf pain, breast pain, clots. It is important to remind mothers to listen to their body more than ever because like when you give birth you focus on your baby and you don't really focus on yourself, but you should because it can be fatal and like you should listen to your body because it just gave birth. So other types of vaginal openings or openings to enlarge the perineal area during birth. So there's episiotomies, which is surgical enlargement of the vagina during birth, median or mediolateral. And I think they did these cuts like to every woman that gave birth like 20 years ago. They don't do that anymore. Hematomas, injuries that cause during birth to a blood vessel. So like that's when the blood vessel contains like large amounts of blood, and it shouldn't contain that much. And there is a picture of I think it's a vulvar hematoma. Vulvar. You can do use of ice packs or surgical management to empty out the hematoma. An episiotomy, perineal care. So after you get an episiotomy, you should ice it for 24 hours. And you can use dermoplast or witch hazel pads, a sitz bath, peri-bottle. And then some things that you should look out for are applying pads front to back. And of course, when you wipe, you should wipe front to back. And no intercourse for like 6 weeks. And you just want to basically take good care of your perineal area since it's like more prone to infections because there's like an open wound there, so you just want to be more careful and keep it really clean. Venous thromboembolism, superficial vein thrombosis, deep vein thrombosis, pulmonary embolism, and these are basically like when your blood clots there, because when you're pregnant you have increased clotting factors. So, and also after you give birth, so you're more prone to develop these. And when like your uterus is pressing down on your lower body, like you're more likely to get blood clots. There's more pressure. So yes, superficial vein thrombosis, deep vein thrombosis, pulmonary embolism, these are all like types of blood clots. Clinical manifestations include sudden dyspnea, pleuritic chest pain, severe apprehension, and there's also swelling and calf pain and positive Homan sign. Oh, and they might have like shiny legs, like not good enough blood circulation. Postpartum mood disorders. I wasn't sure because there wasn't that many directions to include physical, just like the physical problems or like the mental as well. So yeah, I included the mental one as well. So there's postpartum mood disorders. There's 3 types usually. Postpartum blues, depression, and psychosis. So like the blues is the less, no, psychosis is the most severe type of postpartum mental issues. So like blues, depression, psychosis. Blues, most women get it. And then depression and psychosis. So you want to make sure like the mother has, when she goes to like the wellness checks at her gynecologist or obstetrician after giving birth, they should like do a mental test on her to see how she's doing mentally, for like the, just make sure everything's going how it should. And if the mother is having like depression or psychosis, there's certain precautions that need to be taken, like she shouldn't be alone with the baby, or like you just want to prevent anything that can happen negative. So these are my references for the information that I got, and these are my references for the pictures that I could find.